Do you feel like you're walking on pebbles? Maybe it feels like there's a marble in your shoe and you can't shake it out. If you're experiencing pain in the ball of your foot that just won't go away, you're not alone. Today I'm going to reveal why this pain develops, what's really causing it, and most importantly, how to fix it. Stay tuned because what you learn today may help you walk comfortably again. I'm Dr. Andrew Schneider. I'm a podiatrist in Houston, Texas. Every day in my practice, I help patients who are struggling with ball of foot pain, or what we call metatarsalgia. Before we dive in, please take a moment to like this video and subscribe to help others find the information that they need. Let's start by understanding exactly what's happening in your foot. The ball of your foot is an area just behind your toes where your metatarsal bones meet your toe bones. It's designed to help you push off when you walk, but when something goes wrong, every step can become painful. Think of your foot like a tripod, with weight distributed between your heel and the ball of your feet. When this delicate balance is disrupted, certain areas take more pressure than they should. This extra pressure leads to inflammation, and that's when the pain begins. Now, here's something that might surprise you. Metatarsalgia isn't actually a diagnosis. It's more of a description of your symptoms. The real key here is to find out what's causing your pain. In my Houston practice, I see several common causes, and understanding which one you have is crucial for proper treatment. Let's talk about Morton's neuroma, one of the most common causes of ball of foot pain. Imagine a nerve in your foot getting pinched and irritated and eventually forming a painful enlargement. That's a neuroma. Patients often tell me that they feel like they're walking on a pebble, or they might experience a numbness or tingling in their toes. Another frequent cause is capsulitis. This occurs when the joint capsule in your ball of your foot becomes inflamed. It often affects the second toe joint. If left untreated, it can lead to a condition where the toe starts to drift towards your big toe. I've seen many patients who ignore early symptoms, making treatment much more complicated. If you're finding this information helpful, give this video a quick like and let me know in the comments if you've experienced any of these symptoms. Now let's talk about why these problems develop. Several factors can contribute to ball of foot pain. High impact activities like running or dancing, wearing shoes with poor support or high heels, foot structure issues like high arches or bunions, being overweight, which puts extra pressure on the balls of your feet. Even tight calf muscles can increase pressure in this area. Here's the good news. Most cases of metatarsalgia can be treated without surgery. The key is identifying the right treatment for your specific condition. Let me share what works best based on years of treating patients in my Houston practice. First, we need to reduce the pressure on the painful area. This often starts with proper footwear. You need shoes with adequate cushioning and support. Think of it like shock absorbers for your feet. The right shoe can make a dramatic difference in your comfort level. Custom orthotics are often a game changer for my patients. These aren't generic insoles that you find at the drugstore. Custom orthotics are precisely calibrated to your foot structure and condition. They work by redistributing pressure away from painful areas while providing the exact support your foot needs. For Morton's neuroma, we might use specialized padding to spread the metatarsal bones and relieve pressure on the nerve. With capsulitis, we focus on stabilizing the joint and preventing further deterioration. Sometimes we'll use advanced treatments like shockwave therapy, which can be remarkably effective at reducing inflammation and promoting healing. Most patients start feeling better within a few weeks of proper treatment. However, complete resolution can take 2 to 3 months depending on how long you've had the condition and its severity. The key is consistency with treatment and making necessary lifestyle modifications. Speaking of lifestyle modifications, let's talk about what you can do at home. Simple exercises make a big difference. Stretching your calf muscles, for example, can help reduce pressure on the ball of your foot. Rolling your foot on a frozen water bottle can help reduce inflammation and provide pain relief. Here's a simple test you can do at home. Try to raise your big toe while keeping your other toes down. If you can't do this easily, it might indicate that we need to work on your foot's flexibility and strength. Long-term success depends on addressing both the symptoms and the underlying causes. That's why I've written a comprehensive guide all about ball of foot pain. You can get it completely free at www.balloffootbook.com. It goes into even more detail about everything we discussed today. When should you seek immediate help? Watch out for severe pain that comes on suddenly, swelling that doesn't improve with rest, numbness or tingling that's getting worse, pain that's preventing normal daily activities, and bruising around the painful area. Remember, the sooner that you address ball of foot pain, the easier it is to treat. Don't wait for it to become severe. If you're experiencing any of these symptoms, it's time to get it checked out. If you found this video helpful, please share it with someone who might be dealing with similar pain. The link to schedule an appointment is in the description below. Also, don't forget to download your free copy of Ball of Foot Pain Guide at www.balloffootbook.com. Thanks so much for watching, and I'll see you in the next video.